we hear about AI all the time. And I think I told you a couple weeks ago, like, I'm so tired of hearing about AI. Just so many people, it's so scary because they hear like prior authorizations and it can be associated with negative terms, what we hear in the media. But it's getting so much hype. But it's really technology. It's technology advancements and how we can apply to better the healthcare system. So why do you think AI and technology is moving at such rapid space? We've gone from hype to talk to scale where there's so many companies. Like, why now? What's changed?
I think it's such a relevant question, especially when you see the ebb and flow in the media of, is it a bubble? Is it not a bubble? The reality is healthcare actually leads among all sectors of our economy in the deployment and adaptation of really relevant artificial intelligence. And we've gone over the last 2 years from this is a theory to this is actually deployed at scale by payers and providers. But there's a lot of work to do. And the question, getting back to your question, Becca, is why is it happening? What was the sort of the grounds that led to this? And there were a few factors. So first of all, there's the aging population, what's known as the silver tsunami. And with that, the aging physicians, right? So every year, just to give you one example of a specialty, we're losing about 500 cardiologists, which is just incredible, right? And when you look at many of our family and friends, I don't know about all of yours, but they're waiting multiple weeks to see doctors, right? The other force that we're seeing that's compounding this is the change in reimbursement. And so there's a lot of pressures when you're looking at Medicaid and all of that. But there's also a lot of potential and opportunity. One of the things that we're seeing as a trend across healthcare, and I'm talking sort of the big picture here, is we're seeing a trend towards value-based care by 2030. As someone who came from the largest delivery system, that practices value-based care, this is a good thing for patients. But at the end of the day, the devil's in the detail. And the other big trend we're seeing in healthcare is we're seeing a need to move care out of the hospitals and into the outpatient space. And all of us, and the title of our panel is AI as a Force Multiplier. The beautiful thing about AI is it can be applied on every single problem I've discussed, every possible potential future. And I think we can dive a little deeper into that.
Now, I'm just going to follow up with one more. You prompted something, but which parts are primed for disruption in a safe way that can actually increase care, drive results through value-based care arrangements, decrease utilization, and drive outcomes? Like, what are the modalities or the verticals or the specialties that are primed for disruption, ready to go now, that could really advance care if we just turn it on?
So I'm a big fan of keeping things simple. So I like following the patient journey. If you look at the areas that are actively really being deployed right now, it's in a few different spaces. The first is in the walls of the clinic, and it's in the space in which we're interacting with physicians, now with nurses, and even within the pharmacy, and capturing that conversation. I had the privilege of, at Kaiser Permanente, being in charge of our electronic health record, and that's not a good thing. So the electronic health record has transformed care, but doctors love to not like the EHR. And I think that was a good lesson in how to not deploy tech, even though it was successful and there was a lot of policy behind that. It led to a very burnt out workforce. We've learned a lot from that, and we're doing things differently with artificial intelligence. So if you look at just even, I'll give one example, in the documentation space or the AI scribe, it seems almost like it's standard of care now. Many physician offices, when you go in there, there's actually a recording that's capturing that conversation that the doctor is having with the patient. And to all of us who are in our patient shoes, you wouldn't think that conversation would be so tiring, but I don't know how many of you have gone to an office and you've looked at your doctor's back the entire visit while they were just typing. So those days are gone, and there's no excuse anymore for a physician to have their back to you and be typing, because there's AI technology that can do a better job than we each can with our fingers to capture that and then to help code that and then go all the way through the back office. So I think that has been the most successful deployment of AI to date, but it's just the beginning.
So there's a rev cycle component.
Yep.
Just to make it seamless for everyone. So Fionn, what are you doing within Kinetic, the non-emergency transportation space, that not only gets people to care quicker, but through a rev cycle perspective, reduces fraud, waste, and abuse, and prompt pay?
So the company, I actually started, a buddy of mine, he had a Brooklyn taxi shop. And so we went there one day, he needs a database, I go there. and he's manually managing his receivables on this massive Excel ledger. And I'm like, why don't you use a revenue cycle management platform? And remember, he's a taxi owner for 10 years. And he goes, what's a revenue cycle management platform? So I sat down, and 9 years later I'm here, but I sat down in his office and worked on building the nation's first revenue cycle management platform. The transportation marketplace, you don't necessarily see transport providers as a critical function, right? Or playing a critical function in access to care, but they do. They just don't know that they're part of this healthcare continuum, and they aren't necessarily governed properly. The governance starts with the payments, right? You really need to mitigate fraud, waste, and abuse within this space. A lot of these transport companies were using, your traditional HIC 1500 forms, the form that you fill out to send a claim over to a payer. And so the idea was, if you could build a revenue cycle management platform, it's step one into kind of pulling them into the healthcare ecosystem. And so that's what we did. And then we realized, after building the revenue cycle management platform, that the data we were ingesting is incorrect, and they were manipulating the data, and we've reverse engineered it into a full ecosystem of products that allows now health plans to manage transportation in-house. It all started literally with reading through the claim. So there are 53 fields in the claim that must be filled out. We built out an entire technology company by reverse engineering the 53 fields of a claim. So it's just such a critical function, the RCM piece, in understanding payments and services, and also mitigating fraud, waste, and abuse that runs rampant throughout the healthcare ecosystem.